So, tuberculosis is caused by a bacterium. This bacterium is known as Mycobacteria tuberculosis. That's this guy right here. Now, in terms of what our body even does when it comes in contact with this bacterium, is if it is strong enough and the immune system is strong enough, it is actually able to fight it, known as encapsulation. That is seen in this diagram right here, where essentially the bacterium goes into the lungs and it is surrounded by cells and hence encapsulated by the cells, protecting the vital cells around it. In terms of the demographics as well as geography, most of the people who have died from this disease are men, second women, and third children. Now, the places in green on this map are where TB is most prevalent. So these places include Africa, Latin America, Eastern Asia, as well as Russia. In terms of transmission, the infectious dose is roughly 10 bacilli that need to be inhaled into the lungs, and that is transmission. Now, in terms of the incubation period is roughly 2 to 12 weeks, and then you start to show signs and symptoms. Now, the major way TB is spread is through coughing as well as sneezing. And when that little droplet goes from this person to another person, that is how transmission occurs. Now, in terms of the signs and symptoms, most people do not actually experience signs and symptoms even when they have TB. Now, this is because there are two different types of TB. There is latent TB, and there is the TB disease. Now, latent is just an infection, but there are no signs and symptoms, as opposed to the disease, where you can experience all these symptoms, as well as possible death. Some of these symptoms include coughing with blood, chest pain, fatigue, fever, weight loss, stuff like that. Now, in terms of diagnosis, like I talked about earlier, there are two types of TB. There is latent TB, and there is also the active TB, which is the disease. Now, the active TB is really the dangerous one. The latent one, not so much. And now, the only way to diagnose this is through laboratory tests. And you basically send a sample to the laboratory, and they'll determine whether you have the active or latent version, or if you don't have anything. Now, the times when you are most at danger are basically when you are going through an area that has or is common with TB patients. So if you know you are going through an area that has commonly associated with tuberculosis, or work in a correctional facility or a homeless shelter or even a hospital, those can all be dangers if you are worried about getting tuberculosis. Now, in terms of treatment, we do not use sanatoriums anymore, and we in fact use a 6 to 9 month treatment plan. Now, this is based off of a regular schedule of drugs, and which is composed of the 4 core ones listed right here. Now, this is a long time process, but it has proven to be very effective. In terms of prevention, the only way to prevent this is just to wear a mask whenever you go into areas that are commonly associated with tuberculosis. And that's really all you can do about it. However, it's very effective because it keeps the droplets out of your lungs. That is the key. Now, in terms of specific adaptations, tuberculosis achieves adaptations through gene expression. Now, differential gene expression and wherever it can occur is where the adaptations have achieved their greats. It can achieve adaptations in lesions in the lung as well as macrophages. In terms of virulence, virulence is essentially the cell's effectiveness as a disease. Now, PDIM and PLG are the two virulence factors that are major for tuberculosis. And these two factors essentially are surface proteins that make the bacterium just a little different. And this subtle difference is what makes the bacterium just a little harder to detect and just a little better at its job of spreading.